All right, hello, my name is Brittany, and this is my physical examination video. And this is my patient. So the first thing that I'm gonna do, I'm gonna have you actually just stand up again. I'm gonna actually have you walk behind this chair and back in front of it, just so I can assess your gait. Awesome. Perfect. Do you feel as though your weight was unevenly distributed while doing that at all?
No.
Okay, so it seems as though my patient has a smooth and normal gait. So the next thing that I'm gonna do, I'm gonna just kind of see your orientation. So can you tell me your name, what date it is, and what we're doing right now?
My name is Deshaun Taylor. It's April 21st, and I'm getting a physical.
Awesome, awesome. So my patient is alert and oriented, knows name, knows place, and knows the situation of what we're doing today. So the next thing that I'm going to do, I'm going to just assess my patient's cranium. So right now I'm not visualize any deformities or any lumps of the sort. So now I'm just going to touch and do a further inspection. So I'm looking right now. I'm not feeling anything. I don't feel any lumps or deformities. So now again, I'm gonna look in his scalp and see if I see any lesions or deformities either. And I'm not feeling anything in his scalp either. He appears to be very well groomed and his hair was nice and soft. Okay, so the next thing that I'm gonna do is kind of assess the symmetry of his face. I'm looking at his eyebrows. I see that those are symmetrical bilaterally. I'm also looking at his nasal labial folds, and I'm looking at the corners of his mouth right now, which all, if you kind of turn, look very symmetrical. So the next thing that I'm going to do is I'm going to just assess your fifth cranial nerve. So what I'm going to do is I'm going to have you close your eyes and I just want you to say yes if you feel touch, okay?
Yes. 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 Yes.
Awesome. So I'm going to do it once more, okay?
Yep. Yes. 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 Yes.
Okay, so now the next thing that I'm gonna do, I'm gonna have you close your eyes again, but I'm gonna have you kind of tell me, do you feel a soft touch or are you feeling a sharp touch?
That's soft. It's still soft.
So are you feeling a soft touch or a sharp touch?
That one's more sharp. That's softer. That's sharp. That's sharp too. Soft, sharp.
Awesome, thank you. Okay, so now the next thing that we're gonna do, I'm gonna have you open your mouth for me. Just say, ah, thank you. And now I'm just gonna have you smile. Okay, awesome. So right now I'm just able to assess his seventh cranial nerve with a smile. And again, that was all bilaterally. All right, so now we're just going to palpate for some lymph nodes. The first thing that I'm gonna do is just palpate for his occipital lymph node. I'm not feeling anything fixed or not tender at the moment. Now I'm going to palpate his posterior and his auricular lymph nodes as well. So here is our anterior, here is our posterior. Next, we're gonna palpate the submaxillary. Here's the submaxillary. This is the submental I'm now palpating. So now I'm gonna also palpate the anterior and the posterior cervical lymph node. So this is my anterior right here. And then behind, I'm palpating for the posterior. So the next thing that I'm gonna do is now palpate his supraviclavicular lymph nodes as well. Awesome. And so the next thing I'm gonna have you do is actually lift your arms for me like so. And I'm just palpating his axillary nodes on each side. And if you kind of want to put your arms in front of you like so, now I'm just palpating his epitrochlear nodes. All right, thank you. So the next part of the examination we're going to do now is just your eyes, okay? So what I'm going to do right now is test your corneal light reflex. All right, so I'm actually going to have you kind of look towards here, just kind of towards the top of the wall. When I'm looking, yes, that's perfect. So what I'm looking at right now is ocular light alignment. I'm going to shine a light right in the middle of your face. And what I'm hoping to see right now is an even reflection of light on the same spot on each side. And that's exactly what I see right now by testing this corneal light reflex. Okay, so now the next thing we're gonna do is test accommodation. I'll set this down, and what I want you to do is, to the best of your ability, focus on my hand as I move it. Now, to the best of your ability, just focus on your nose and try to look at the tip of your nose. Awesome. Okay, so the next thing that we're now going to test is we're gonna do an external inspection of your eye, okay? So now I'm just gonna kind of make sure I have my proper setting. Okay, so I'll kind of have you again stare at that same point on the ceiling. Perfect. Sclera looks nice and white. All right. So now, the next thing I'm gonna do is just shine the light directly kind of into your eye and see if they both constrict. So when I shine a light into one of your eyes, one should constrict, okay? So I'll do that right now. Perfect. And I'll do that again. That's exactly what I want to see. That's wonderful. So the next thing that I'm now going to do is I'll have you follow my finger wherever it goes, okay? So I'm gonna kind of go in an H shape. I want you to try to keep your head fixed. The only thing that should be moving right now is just your eyes. So we're gonna go in our H shape. Perfect, awesome. So the next thing that we're going to do is our Fields exam. So what I'll have you do, I'll have you stand right here at the end of this bench, and I'm going to have you cover one eye, and to the best of your ability, I'll have you read to me the letters on the chart in order from left to right.
All right. H, N, P, T, X, Z, F, Z, D, T, N, T, X, Z, H, Z, N, P, P, H, U, N, T, D, N, P, X, T, F, H, U, Z, D, N, P, T.
Okay, wonderful. So now I'll have you cover your left eye this time and do the same thing from left to right.
H, N, P, T, X, Z, F, Z, D, T, N, T, H, X, H, Z, N, P, P, H, U, N, T, D, N, P, X, T, F, H, U, Z, D, N, P, T.
Awesome. All right, so you can take a seat. Thank you very much. All right, so the next thing that we're going to do is our fundoscopic exam. I'm now going to just dim the lights in here. This one has more people. There we go. All right. So what I'm going to be doing at this moment is kind of from a further distance now, I'm going to kind of try to get that red light reflex in your eye at this time, okay?
All right.
Okay. Now have you open, kind of look elsewhere. It might make it a little, there we go. All right, no hemorrhaging is present. It seems as though there is symmetry in the vessels in the eye as well. All right, thank you so much. So we'll turn back on that light. Okay. So moving on, the next thing that I'm gonna do is kind of start inspecting your ears at this time. So the first thing that I'm gonna do is inspect your external ear. So, so I have a covering that we'll use just so we stay sanitary, okay? And as of now, we'll just have you hold still. And I'm currently just looking at the external ear. No scars or lesions are noted. I'm also not noting any inflammation on the helix or the antihelix or the tragus or the earlobe as well. I'm gonna just move over to the other side. And again, no scars or lesions are noted, and I'm not noticing any inflammation in the helix, the antihelix, the tragus, or the earlobe as well. So now we're gonna just take a deeper look, and we're gonna just look actually inside of the ear, okay? So what I'll have you do is keep your head still with me, just so we don't injure you as we're doing your examination. Awesome. So right now I'm currently visualizing a normal tympanic membrane. I don't see any irritation inside. And I'm pulling the pinna back as I do this. And again, I see the same for the other side as well. So I'll just turn this off at this time. Perfect. So now we're just going to do a hearing test, and we're going to do a test called the Raines test. So what I'll do, I'm going to use this tuning fork, and I want you to tell me whether you hear better sound at point A or point B. Point A being the first place that I put the ringer, and point B being the second place, okay? Okay, so I'm gonna hit my leg. Hold on to that in.
I hear it a lot better at point A.
Okay, so now we'll look in the second ear as well. And we'll do it again on the other side.
Yeah, a lot better at point A.
Okay, so we're gonna say point A bilaterally on both sides. Okay, so now the next thing that I'm going to do is just look at his septum. I'm going to look at his turbinates in the nose, and I'm also going to just look at his nasal mucosa at this time, okay? So I'm going to use this light again. I'll make sure that I'm exchanging out the tip before I start. Okay. All right, so what I'll have you do is lean your head back for me. Thank you. And I'm going to just lightly pull up on your nose. All right, so at this point, I'm not noting any septal deviation. I'm able to visualize his turbinates as well. Awesome. So now the next thing that I'm actually going to do is just palpate your nose, okay? When I'm palpating your nose, are you feeling any tenderness?
I mean, not really.
Okay. So now the next thing that I'm going to do is palpate his sinuses as well, okay? So just gonna palpate your sinuses. Okay. Did you feel any tenderness when I palpated your sinuses?
No.
Okay. So now we're going to just go ahead and test that first cranial nerve right at this time. So first thing I'm gonna have you do is smell 2 smells for me. Okay, so what I'll have you do, just to eliminate anything, I'll have you not only close your eyes, but I'll have you hold one nostril like this. Okay, so I'll have you close your eyes, and in one nostril, I want you to kind of tell me what you're smelling.
That's coffee.
That smells like coffee? Okay, so I'll have you switch your hands and we'll plug up that other nostril. And I kind of want you to now tell me what we're smelling. Maybe not so identifiable as the first one.
Rubbing alcohol?
Yeah, that's exactly what that is. Okay, awesome. So that was us testing that first cranial nerve, okay? So now what I'm gonna do, I'm gonna just assess your mouth, okay? So I'm gonna have you open your mouth up wide for me. And as you're opening up your mouth wide for me, I'm looking at my patient's lips. I'm not seeing any cherry red color. I'm not seeing any blue color. His lips are a nice pink color and they're also moist, okay? So now the next thing I'm gonna do is actually look inside your mouth. I'm gonna look at his teeth. I'm gonna look at his gums. And I'm also going to look at his tongue as well. So look inside your mouth. Awesome. So now I'll have you say ah real wide and stick your tongue out while you're saying ah. Like out of your mouth, stick your tongue out. Awesome. So now at this point, I'm going to use a tongue depressor. Okay. So I'm gonna have you again open your mouth once more and stick your tongue out. Awesome. And I'm gonna use this as well. Thank you. And just kind of relax your tongue as you're sticking it out perfectly straight. Awesome. Now say ah again. There we go. I'm able to visualize his uvula. So I'll have you stick your tongue out like as much as you can. Awesome. And try to resist me doing this to the side of your tongue. Perfect. Same with this side. Perfect. Now on the inside of your mouth, I want you to do this. Perfect. And try to resist me touching that. And we'll switch sides. Awesome. So during that examination, I was able to note that my patient had, again, nice pink gums. I did not notice any purple color. I was looking at his teeth. They were also nice and white as well. And his breath smell was a normal breath smell also, okay? No signs of decay. So next thing we're gonna do is kind of do some neck motions, okay? So kind of, if you will, I'll have you do some range of motion exercises, okay? So I'll have you take your neck and I'll have you look at one side like this, slowly side to side for me. And to the other side. Okay, so can you look down as far as you can? Awesome, and now being very careful as to not irritate your neck, I'll have you look up as much as you can. Okay, awesome. Now tell me, how did that feel? Did you feel any pain or any tenderness on any of those sides?
No.
Okay, awesome. And so the next thing that we're going to do is I'm gonna just kind of feel the veins in your neck at this time, okay? So now, I'm not seeing any JVD distension right now. His neck area is really nice and really smooth. There's nothing protruding out at this time, okay? So now I'm gonna take my stethoscope and I'm gonna listen with the bell at both sides to see if I hear any carotid bruit at this time, okay? Okay, other side. Okay. So now I'm just going to assess my patient's thyroid at this time. Would you mind taking a small sip of water for me and holding it in your mouth? Okay. So now I'm going to assess your swallowing. Can you swallow for me? Awesome. So now I'm just going to feel my patient's thyroid, see if I feel any like thyromegaly. All right, can you swallow again? Okay, any tenderness with swallowing at all? Okay, awesome. Okay, so now the next thing that we're gonna do, we're gonna have you, I want you to try to raise your shoulders, and I kind of want you to resist me pushing down on them, okay? So raise your shoulders up. Perfect. That's a nice strength right there. Okay, so now the next thing that we're going to do, we're going to kind of move to our seated position or our laying position, and we're going to start on our examination of the breast at this time, okay? So we'll move some stuff around so we can do that. Move this chair, and we'll have you lay down right here. Perfect. All right. So the next thing we're gonna have you do, we're just gonna kind of assess your breast at this time. So now I'm doing a visual inspection. At this point, what I'll have you do is lift your arms up for me. Perfect. Now, can you put your hands on your hips like so? Perfect. Now, if you can take your hands right here and push them together.
Like
Yeah,
this.
that's perfect. Push them together. I guess kind of like you're doing a bodybuilder type deal. All right, and then lean forward in the front. Perfect, and you can lean up a little bit when you lean forward.
So like this.
Yeah, that's perfect.
Okay.
Awesome. All good. So right there, I was just inspecting his breast from different angles to see if I saw any abnormal results from that. I didn't see anything. Right now, his nipple structure looks very symmetrical on both sides. We're not seeing any crust forming, and we're not seeing any irritation in his chest area generally, okay? So now the next thing that we're going to do is just do a breast examination, okay? So I'll have you lay down flat completely. Okay, and the purpose of this breast examination is just to see if I feel any like fixed hard nodules in his breast at this time. And the technique that I'll be using today is the side by side, where I take each of my fingers and I slowly touch to see if I'm feeling any abnormal spots in his chest. Okay, so I'll start from here. Keep nice and relaxed, and just let me know if this gets tender at any time or if this hurts, okay? Awesome, thank you. So at that time, I did not feel any fixed or hard lumps in his breast. Everything was perfectly smooth, just as expected, okay? So now the next thing that we're going to do is kind of evaluate his thorax. So what I'm gonna have you do is take a really deep breath for me, okay? I'll have you kind of sit up nice and straight, and I'll have you take a big breath for me. Awesome. Was there any tenderness when you took that breath just now?
No.
Okay, awesome. So the next thing now I'm going to do, I'm going to feel along his anterior and his posterior side, and we'll do a little tactile Fermat's test, okay? Okay, so now each time that I'm like moving down your side, each time you feel my hands move, I'll have you say the numbers 99 for me, okay?
Okay. 99, 99, 99, 99, 99,
Okay, have you lean straight for me?
99, 99, 99.
Okay, awesome. Thank you so much. So now the next thing that we'll do, I'll get my stethoscope again. I'll make sure that I have it nice and wiped down, because now we're going to just percuss your lungs, okay? So before I percuss your lungs, I'm gonna just make sure that I'm listening to it as to not disrupt anything. Okay, so each time I move my stethoscope, just take a really nice deep breath for me, okay?
Okay.
Okay, so now I'm gonna listen to the lung sounds on the back. Awesome. So now I'm going to percuss, okay? If at any point in time, if this feels painful, you let me know, okay? So if you sit up nice and straight for me, we're just going to. Okay. How did that feel just now?
It felt okay.
Okay, did that hurt at all? Was it tender?
No.
Okay, awesome. So now the next thing that I'm going to do, I'm going to just inspect his chest area because we're moving on to the heart now, okay? So I'm looking the area where his heart would be. I don't see any redness on his chest. I'm not noticing any bruising of any sort. I'm not noticing any swelling either. So now the next thing that I'm going to do is I'm going to palpate 4 spots on his chest. In addition, I'm also going to palpate his PMI, okay? So what I'll have you do is I'll have you lay down. Perfect. So, in these first 4 areas, I'm not expecting to feel the thump that I might feel when I palpate for my patient's PMI. Is it uncomfortable laying down like this?
No, this is fine.
And right here, I'm feeling the thump on my finger, right here for his PMI. So now what I'm going to do is I'm going to auscultate his heart in this position and then in the upright position, and then I'll also do it using my bell and my diaphragm. All right. Okay, so I use my diaphragm and my bell, so now I'll just have you sit up and we'll go ahead and do the same thing from this position. All right, awesome. How did that feel? Okay, so now I'm gonna have him lay back down and I'm going to do an abdominal assessment at this time, okay? So the first thing I'm gonna do for his abdominal assessment is I'm going to inspect. I'm looking, it looks as though he has great muscle tone on his abdomen area. I'm not seeing any uneven curvature. Even staring from this position, it doesn't look as though his stomach is distended at all. Do you have any tenderness that you're feeling in your stomach area at all?
Not really, no.
Okay, awesome. So the next thing I'm gonna do is now just auscultate all four quadrants and his aorta. Okay, awesome. Now the next thing I'm gonna do is just palpate his abdomen. Okay, let me know if this hurts. Everything is feeling nice and soft. So now what I'm gonna do is palpate for his kidney and palpate for his liver and for his spleen. So a harder press right here. Seeing if I see anything, feel anything. Palpating for spleen right now. And some femoral pulses a little further down. We'll do it right here in this area over the shorts. And so now we're also going to do just some percussing. All right, I heard that tympanic sound right there. Okay, awesome. So now you can stand up and I'll go back and I'll get your chair. Okay, so you can take a seat right there. Perfect. So now we're just going to do some extremity testing. So right now I'm looking at his extremities. I'm not noticing any deformities or any lesions. This is also like a part of my skin assessment either, not noticing any deformities or lesions or anything or swelling or anything of the sort. So now the next thing that I'm going to do is just palpate his joints. So we're going to palpate some upper joints, palpate some lower joints as well behind the knee. Also, we're going to palpate some pulses as well. So what I'll do is I'll palpate his radial pulse. And I feel his radial pulse. I'll do it on this side as well. All right. So now I'll have you lift up your foot and we'll palpate his posterior tibial pulse. I'll take your other foot. We'll do the same. Okay. And it feels as though those pulses are equal bilaterally. Okay, so now what we're we're just going to do some range of motion exercises, okay? So it's up to you, but how about we lay back down? And we can move this out the way to avoid some injury. Perfect. Okay, so what I'm gonna have you do, I'm gonna have you lift your leg off the table, just one leg up. Perfect. So now I'm going to take this leg. Perfect. We'll take it inward as well. I'll have you bend your leg for me. Okay, we'll take that and inward, and then I'll have you rest your leg right there. How does that feel?
This is normal.
Perfect. So we'll do the same with this leg. I'll have you lift your leg up, okay? I'll pull it outwards towards me. Pull your leg inwards. I'll have you bend, okay? Outward, inward, and back to rest. How does that feel?
Normal too.
Okay, perfect. So now the next thing I'll have you do is flex your ankles for me.
This?
That's perfect. So now what I want you to do, I want you to try to lift your legs up and try to resist me pushing them down. Perfect. Now try to resist me pushing them up. Perfect. So I'll have you lean up for me, and I'll have you do the same thing with your upper hand. So I'll have you lift up. Perfect. Lift down. Take your arms to the side. Bend them. Move them down like so. Move them back up. Move them backwards. Perfect. So now what I'll have you do is take your hands like so and try to push against my arms, pushing you back. Keep it in the same position. Perfect. Now same thing with upwards. Perfect. Now squeeze my hands nice and tight. Perfect. Nice muscle strength right there, okay? So now the next thing that we're going to be doing is just testing some of your reflexes. But before we test your reflexes, we're just gonna actually look at some motor things. So what I want you to do is take this pen and I want you to cap it and uncap it and cap it and uncap it. Just do that for me twice. Perfect. So I'll have you hold on right here. Now try to cap the pen from in my hand. Okay, and one more time. Perfect. Okay, so now we can test your reflexes, okay? What we're gonna do is I'm going to take our instrument from earlier, okay? And first things first, we're going to start with your bicep, okay? On both sides, so nice and relaxed. Perfect, other side as well. Okay, now I'll have you, we'll do your tricep now. Have that nice and limp for me. Perfect. We'll do the other side as well. Perfect. So now the next thing that we're gonna do, we're gonna also test your plantar reflexes. Our instrument to do so. So for this, we will use a tack, okay? So it's a little sharp, but we're gonna just make sure that it doesn't hurt you. Our other instrument has just now disappeared. So what we'll do is I'll have you put your foot up for me. Nice and straight. And let's see. Perfect. I'll see your other foot, and we'll do the same by testing your plantar reflexes. See if your toes are cool. Perfect. Okay, so that is a negative Babinski test right there, just exactly like what we like to see. So now we're going to test your brachial radialis, and we're also going to test your knee and your ankle reflex, okay? So for your knee, what I'll have you do, I'll just have you scoot back just a little bit so your knees are dangling. Perfect. Perfect. There we go, that one's more of a reaction. Okay, so now we'll do your ankle, and I'll hold your ankle like so, and I'll kind of support it in this position. And we'll hit it and see what happens. Okay. Perfect. Okay, so we're almost done here. The last thing we're going to do is test vibration, proprioception, and touch and pain, okay? So for vibration, we'll use that same tuning fork. And I want you to just tell me if you feel the vibration on some bony prominences, okay?
Okay. No.
One more time. Let's try it this way.
Yeah, I felt it a little that time.
Okay.
Yeah, I feel it better that one.
Awesome.
No. Yeah, wow.
Okay, awesome. Okay, awesome. All right, so now I want you to just take your hand out like so, and I want you to close your eyes for me and tell me if you're feeling soft or sharp.
It's soft. That's sharp. That's soft.
Okay,
That's sharp.
awesome. Okay, hopefully not too sharp.
Mm.
Okay, so now what I want you to do is kind of keep your eyes closed and hold your hands out for me like this.
Like that? Oh, like that.
Perfect. And now tell me, am I pulling your joint upwards or downwards?
Up. Down. That's up. And that's down.
Okay, awesome. Now, for the last thing that we'll be doing, what I want you to do is tell me whether you're feeling a fingertip or if you're feeling a wisp, okay?
You want me to close my eyes too?
Yes.
Okay.
Or I should say a wisp, or if you're feeling pain. And we'll use the sharp object again, and it shouldn't be, again, too painful, okay?
No.
So close your eyes.
That's sharp. That's soft. Sharp. Soft.
Okay. Well, Jacob, thank you so much. And that was the end of my physical assessment.